Hey everybody, it's Dr. Chris back with your 12 Minutes to Health this week. I'd like to say thank you for joining us for the 12 Minutes to Health each and every week, where we take the time to dig through the research and look at what it says about eating well, moving well, and thinking well, so that we can live a healthier lifestyle, because that's what these talks are all about. You know, we've made the commitment to dig through the research, find the best available research for you guys about what it says to be healthy, and how we go about teaching our patients and educating our patients. And as I tell you each and every week, every Tuesday night, we welcome you to come into the clinic to watch the talk and also be there with the doctor so that you can write out some questions and get those answered, and make sure that you're getting the most out of this for your health, the benefit of you and your family's health. So again, this week we've dug into the peer-reviewed randomized controlled trials, right? We're not just looking at what's the new marketing, what's the new magic button or magic pill or whatever it is that we're coming out with for health. We're looking at the real research in the peer-reviewed medical journals so that you get an unbiased, evidence-based approach to how to live a healthier lifestyle. And as always, that is a well-rounded lifestyle for us that comes down to eating well, what we're putting into our body, moving well, getting more exercise, and then also thinking well. And that's what we're going to be looking at tonight, is how stress is affecting our body. So go ahead, sit back, take some notes, enjoy refreshments if you do get into the office on Tuesday night, and let's get started. So look at our study this week. The study was done by Dowd, Simonek, and Alo, and what they looked at is the socioeconomic status, how that affects the levels of cortisol, or the stress hormones that are in your body, and the allostatic load that creates on your body, or else the rocks in your backpack that I always talk to you guys about. And we'll talk more about that as we get down to it. But I want to be clear on this, because the socioeconomic status is really what they're looking at and how that's affecting your health. But they're only looking at the stress side of things in this study, right? And this is a review of the literature. So there's a bunch of different studies that they looked at to get all of this information. And having a decreased socioeconomic status can actually affect you more than just stress, right? It can be harder to get the right food to put into your body. You may not join a gym, or it may be harder to exercise because you're sometimes working harder, longer hours, and you're fatigued because of the stress. And I think the main point is that all this stuff works together, right? Health is not this and this and this. It's everything put together, and we need to make sure that we're paying attention to that. But it is important to understand the individual components that we need to put together to create that healthy lifestyle or a healthy environment, and stay as close as we can to homeostasis, like I always talk about, keeping ourselves healthy and happy and working together. So when we dig into this study, some of the stuff they looked at, and one of the biggest takeaway, I mean, even in the introduction of the study, they said there is a significant correlation between a decreased socioeconomic status, and that didn't matter whether you were talking about income level or higher education level, however the patient in the study viewed their socioeconomic status. Well, when it's decreased, you have an increase in morbidity and mortality. So we live a worse life, a less healthy life, and we're dying sooner because of a perceived lower socioeconomic status. And that, again, has to do with money, and it also has to do with higher education, because it causes an increase in our cortisol levels. So we are more stressed out. The more decrease we have in socioeconomic status, the more of an increase we see in cortisol and chronic cortisol, which we'll talk about in a second, why that's so much worse than acute cortisol inside of our body. The acute stress response is actually a very normal thing. Okay, it's life. Life happens, right? And we're going to lose people in our life, loved ones, close people to us. We're going to lose animals. We're going to have just bad days. There's sad events that happen, things that make us mad and stressed out. And that's perfectly normal. And for us to respond by being sad, by being a little bit depressed for a short period of time, those are completely normal responses, and our bodies are designed to respond in that way. The big big thing that you're going to find, though, is that your level of resilience, your ability to bounce back from a sad event, from a tragic loss, whatever it may be, is what determines the level of cortisol and how long it stays in your blood. And what we're finding out is that most of us, especially when there's a decrease in socioeconomic status, we find that you're going to have an increase in the chronic cortisol. And that's not good for us, because then we're living in a stressed out state, which is just, one, not enjoyable, but two, very detrimental to our health. And it increases our allostatic load, which we'll talk about in a second. But the chronically elevated cortisol that they found in this study, due to a decreased perception of socioeconomic status, led to a couple of things, but what they noted mostly was immunosuppression. Right? When we talk about immunosuppression, that's your immune system's ability to defend your body being shut down. It's being suppressed, and you're not as capable of fighting things off as you normally would be. Look at our current situation with COVID-19. I mean, this is very present in our lives right now. There is a higher level of stress. I think we can all agree on that. I know that, being locked at home, working from home all the time, seeing what the economy's doing. If you run a business, or some people have lost their jobs, suicides are up, especially amongst younger people. It's just that we're chronically stressed out right now due to all this, and we're getting sicker and sicker because of it, because our immune system cannot work when we have an elevated cortisol level like that. And they found the same thing in this study over long term. When you have a decreased socioeconomic status, you're going to have increased cortisol, which decreases the function of your immune system. They also found that you have a higher insulin resistance. So that means that our body is not using insulin the way it should, because of how cortisol and insulin interact with one another. So again, that decreased socioeconomic status leading to chronically elevated cortisol is lowering our insulin resistance. So, and then lastly, they found that there's a big increase in cognitive decline as you have chronically elevated cortisol as well. So we're seeing things pop in like dementia and Alzheimer's at earlier ages, and more frequently among people who have chronically elevated levels of cortisol due to a decreased socioeconomic status in this study in particular. Now, like I said earlier, there's other things that go into that, like what kind of food are they putting into their body? How much exercise are they getting? Exercise definitely affects our mood, and there's plenty of studies to show it. But what they did is they isolated just the cortisol and tried to make that the key factor in this review of the literature. So again, health doesn't always work that way, but the studies, it is important to understand the individual aspects of health. One of the biggest things that they noticed about the chronic cortisol, the decreased socioeconomic status, all of it, what it's doing is it's increasing our allostatic load. Okay, now if you've watched some of my talks in the past, you know that I've talked about this with the example of rocks in the backpack, right? And to keep it really simple, rocks in the backpack, if you look at the photo here, you got the guy floating along there, and he's got some rocks in his backpack. Those rocks are representative of the allostatic load, basically the negative things that we do for our health, right? Put something bad into our body, that's like a rock in the backpack. Put in something good, omega-3 fish oils, vitamin D, the stuff that we talk about, the essential nutrients, that's taking rocks out of the backpack. That's moving towards health, not away from it. So what the study found is that as you decrease the socioeconomic status, you have an increase in that allostatic load. You're putting more and more rocks into the backpack, right? And like I said earlier, too, you can have those acute rocks that we lost a loved one or whatever it may be, but the important thing there is your resilience. How quickly do we get that rock back out of the backpack and lower the allostatic load? Because at the end of the day, that's the big thing. How are we balancing out? How are we staying afloat? How many rocks are in the backpack? What they notice is chronic stress adds a lot of rocks to the backpack. And we see that throughout the study. I mean, there's increases in blood pressure, increases in cholesterol, decreases in the good cholesterol, increases in the bad cholesterol. Low density lipoproteins were way up in the studies when they looked at this different stuff in these areas of a decreased socioeconomic status. So it's very important to understand how stress and cortisol plays into all this, because we are chronically stressed out as a society right now, especially during what the pandemic and everything else that we've been going through. So it's even more important that we concentrate on the fact that we do have rocks in the backpack. And yeah, maybe those are increased right now. We've got to start to get those things out. And we get those things out by observing what are we doing that's good for our health. Are we putting the right things into our body? Are we eating the right things? Are we moving as much as we need to and getting the exercise? And then are we addressing the stress? Are we being resilient? Are we bouncing back from the stress and not letting that stress become chronic? Because that's where we really start to see the issues, is when the stress becomes chronic. And our health pays for it, and we degenerate faster and faster and faster. And when you look at it, we're all degenerating. We all have stress. There's things that hit us a certain way. But how much are we doing to slow that stuff down? And that's where, eating well, moving well, and thinking well comes into play. And that's why in our office, with all of our new patients, we do an exam, we do a consultation, we do any x-rays we need to, and then we do our spinal health assessment, which is essentially, it's just a proprietary health software that we use in the clinic so that we can get you a personal health score and see how your lifestyle overall is affecting your health. Right? And as you guys know, we normally do that for about $289 in the office, but we've lowered that cost down to just a $39 donation to the charity of the month that we're working with in our community, so that we can get you into the office, get you your health score, and see, why do you have these aches and pains? Why isn't your health where it needs to be, right? And by lowering the cost down to $39, which again is a donation, that allows us to remove any obstacles for you. Take away all the excuses that would prevent you from coming into the office, because you've got to start to take care of yourself. We've got to get healthy, lower our chronic stress, and take the rocks out of our backpack. So give us a call, set up an appointment, come in and see us. But thank you guys again for showing up each week for these 12 Minute to Health talks. I really enjoy doing them and going through the research for you guys. Make sure you get your questions answered, and I'll see you next week at our 12 Minutes to Health. Thanks.